Some of you may not know it or care, but the United States is headed for a Holocaust. Its cause is obvious to all of us, but never discussed out loud. I am here to break that little taboo and talk about that problem. Would you want your lovely daughter to die a cruel, agonizing death from a ruptured appendix, or your fine son to lose his arm to gangrene caused by an infected hangnail? There are too many people going bankrupt or committing suicide because they cannot pay their medical bills. Others are going without because they cannot afford the premiums. Why do we allow this situation to perpetuate? Believe it or not, there are some people in this world to whom profits mean more than human life does. In keeping with my indictment of capitalism in general and the demand that it be made transparent and auditable, I think the same indictment needs to be made to our healthcare system. A healthcare executive's new limousine is not a justifiable reason to raise healthcare premiums. Many people in the healthcare industry will need to take drastic pay cuts. Cancer, in particular, causes millions of tragic deaths each year, but the real tragedy is that so many of these cancer deaths are unnecessarily premature. And yet, we do not want to fix the problem by offering inexpensive genetic therapies such as monoclonal antibodies or oncolytic viruses to make deadly cancers a thing of the past. Because it would erase the profits of the companies which manufacture chemotherapy drugs which are inexpensive and largely ineffective. There was a time when antibiotics were the new miracle drugs, and people really believed doctors had shamanic powers. These days, the mystery has begun to wear thin, and even doctors themselves are beginning to wonder, as I wonder, where all the money is going. And yet, the last thing the industry wants is accountability, though they know it provides the only solution to what promises to become a very tight bottleneck situation. Sadly, healthcare and capitalism do not mix. Up until now, this has been America's healthcare policy. This needs to change.